Well, people living with HIV are not receiving enough counselling after they are diagnosed. That's according to the Positive Action campaign. The organisation says health facilities are more focused on the statistics than the wellness of patients. Meanwhile, the United Nations has appealed for a record $51.3 billion to fund its work in 2023. The figure is a 25% increase on its appeal last year. The UN Global Humanitarian Overview estimates that an extra 65 million people will need help next year, bringing the total to 339 million in 68 countries. This as today marks World AIDS Day under the theme Rock the Ribbon. UN AIDS is urging each of us to address the inequalities which are holding back progress in ending AIDS. To take this discussion further, we're now joined via Zoom by Professor Geoff Setswe. He's the Managing Director for Implementation Research at Aurum Institute. Thank you very much, Prof, for joining us here on SABC News.
Thank you so much for inviting me.
You're most welcome. Has there been, significant progress in the fight against this pandemic globally? I mean, what are we commemorating or celebrating today as we do commemorate and celebrate World AIDS Day?
Yes, the HIV pandemic is now 41 years since 1981 when it was first established. We have made significant progress in all these years. And, this year we're focusing on inequalities, and the theme for commemorating World AIDS Day this year is to equalize. And the key message that comes from the UNAIDS is that inequalities are blocking our goal of ending the AIDS pandemic all over the world, and that we need urgent action to tackle the inequalities that we identify, whether it's among young men, young and key populations.
Let's talk about the fact that, another pandemic, COVID-19, might have also played a role in disrupting, the fight against HIV/AIDS. Let's talk about the effect that particular pandemic had on whether it is HIV treatment or perhaps affecting inroads that might have perhaps been made, which you speak of.
Yeah, we had set up the goal of ending AIDS by 2030, and we were already making good progress by 2019. But between 2020 and 2021, we were delayed, because the focus was now on COVID-19. And people who were taking their treatment, who were getting virally suppressed, and where we were making good progress on prevention, that all that progress was delayed because of COVID-19. Yeah. It is only now in 2022 that we are developing catch-up programs to recover the time and the efforts lost in the last 2 years.
Prof, you spoke about the issue of inequality, which is blocking some of the progress that can indeed be made when it comes to the fight against HIV and AIDS. And realistically speaking, South Africa being one of the most unequal countries in the world, and on the back of that, South Africa being one of the world's high-ranking countries when it comes to the infection. Realistically, I mean, would we be able really to end AIDS, given those two issues that you're obviously, as people working in this space, are grappling with?
Yeah, I'm very optimistic about things. The inequalities are deep. It's inequalities of access. There's gender inequalities. We still have harmful masculinities, patriarchy, unequal power relations between men and women. We have high levels of gender-based violence, high levels of interpersonal violence. We've got inequalities that are faced by key populations, about sex workers, MSM, people who inject drugs, and inequalities between the treatments that adults are getting and children are getting. But the UNAIDS is saying that we know what to do to end inequalities. We need to equalize access to rights, access to services, and access to the best science and medicine. And even if South Africa has got the highest level of inequalities in the world, we still have a constitution and Section 27 of the Constitution that provides, protection, around health and access to services we have done a lot, and we can actually reach out to people who have been discriminated, who have been left out, of the mainstream of society. We're producing the best science, and medicine, and therefore people should benefit from, evidence-based interventions that we're developing.
Prof, as we wrap up our conversation then, what's your message today as we do indeed commemorate World AIDS Day?
I think the key message is that we need to equalize access to the rights. We need to support women's rights organizations. We need to have policies to interrupt the power dynamics. We need to ensure that young women go to school. Education is a protector. Research has been very clear. But my biggest message is we need to equalize because equalization does not only help people who are marginalized, it also will help everyone in society.
All right, Professor Setswe, we appreciate your time, sir. Prof is the Managing Director for Implementation Research at the Aurum Institute today on our discussion on World AIDS Day. We're going to take a short break. Your sports news.